Recognize.
Thank you, Mr. Speaker. Please recognize Representative Rudman.
Representative Rudman, you're recognized in debate.
Thank you, Mr. Speaker. I'd like to start off by commending the bill sponsors, first of all, for recognizing that there are sometimes some valid reasons to have surgery. And this bill actually provides exceptions for those patients. Those with ambiguous genitalia, chromosomal issues, or enzymatic hormonal deficiencies. All these cases are extremely rare. I thought it was extremely thoughtful that you included that in your bill, so thank you for that. As far as gender dysphoria goes, I have at least 3 teenage patients in my practice with gender dysphoria. All 3 are loyal patients. None of the 3 have ever asked me for surgery. None of the 3 get hormones from my office. And they know all this up front when they make their appointments. But they keep coming back for appointments. Matter of fact, even though they know I'm not going to prescribe or recommend these treatments, they recommend me to their friends. Now, how can this be if I'm depriving them of vital and life-saving care? Well, I think you know the answer is simple. I listen to them. I provide counseling for them. Sometimes that's all a patient with gender dysphoria needs. This whole notion that elective mutilation is somehow the only logical treatment is simply preposterous. And you'll also notice I never use the term puberty blocker. That is just a euphemism. What it is the inappropriate prescription of hormone in a condition for which it was never intended. Among other things, these hormones can stunt growth, decrease bone density, and cause infertility. So you can imagine how I felt yesterday when I was sitting here listening to people with no knowledge of the facts complain about asking a child to wait until they are an adult before starting dangerous therapies. I want you all to understand, I can't even remove a wart from a child without getting informed consent from their parent first. Do you also not understand that a lot of times in medicine, the best answer to a situation is to just wait? It's called observation, and it is a valid choice in situations where the patient is simply too young to risk procedures. But I'm just going to cut right to the chase here. You see, there's not a whole lot of money to be made through observation. When I see a child for gender dysphoria, we may talk for 45 minutes or an hour, and I'll get paid less than $100. But that's okay, because I'm guided by conscience, not by money. However, as we learned from the situation up at Vanderbilt, we now know there are plenty of doctors who are not guided by conscience, but by the fact that these surgeries pay a lot of money. Now, I may not be able to do anything about those bloodsuckers at Vanderbilt, but I can sure protect our children from unscrupulous doctors right here in Florida. The art of medicine is not for sale. Doctors are not short order cooks taking orders from children. We do not irrevocably change someone's life for the sake of a fad. And furthermore, we do not conduct scientific experiments on children. I urge every Florida physician, protect your children and follow your oath. First, do no harm. And I urge all my colleagues in the chamber to protect our children by voting for this good bill. Thank you.
Representative Grant, you're recognized.
Thank you, Mr. Speaker. Please recognize Representative Black in debate.
Representative Black, you're recognized in debate.
Thank you, Mr.